Today's session in the GP Task Force's EDI Lunch and Learn sessions is looking at how we support practice LGBT plus patients and staff. To just introduce myself to anybody that hasn't met me before, my name is James Betteridge-Sorby. I'm a GP partner down at the bottom of the county in Swadlincote. And as a gay man, I was part of a group of GPs that were working with the Royal College of GPs to look at how we care for not only LGBT plus patients, but also staff working in primary care. And in doing that work, we were drawing on our own personal experiences of what it's been like to be a patient within the NHS and to work in the NHS, and try and bring those experiences to form some of the guidance that we were giving around policy, and also some of the education packages as well. We recognise that LGBT plus healthcare is something that historically hadn't been really kind of included in the curriculum for GP trainees, and we've been able to influence that as well. So just as a bit of a background, today is the third and final talk in a series of 3 talks I've done over the course of the summer around LGBT plus health issues in primary care. For anybody that's missed any of the previous 2 sessions, they're available on the GP Task Force's YouTube channel. Just as a recap of what we've done already, the first talk was an introduction to LGBT plus health in primary care. And in that talk, we looked at the sort of history of LGBT plus care over the last sort of 50 to 100 years or so in the UK, and some terminology. We looked a bit at population statistics in the UK and how health and the health related behaviours of the LGBT plus population manifested in primary care, and how those patients might face some health inequalities. And the most recent session looked far more at the clinical care of those individuals. And in that session, we talked a bit about screening, particularly around cancer screening, health promotion, gender dysphoria, and onward referrals to gender identity clinics, fertility support for LGBT plus patients who are wanting to start families. And we had a little talk about PEP, PrEP and HIV. So today's talk is going to look really kind of more at a sort of practical level of how you can support not only your sort of patients within the practice in things such as kind of how you might want to improve, say, kind of your visibility of sort of showing your support for your LGBT plus patients within your practice, a little sort of bit about thinking about coding, and then also a bit about supporting your LGBT plus members of staff. And that's going to draw on some work that's been done over the last couple of years about the experiences of LGBT plus staff working within the NHS, and how that might impact on some HR considerations for general practice as employers. And finally, I'll just touch on some accreditation schemes and some further learning opportunities that are available for practices, and some signposting for wellbeing support for your staff if needed. So to start off with, thinking about improving sort of visibility within your own practice, we know that Healthwatch Derbyshire, so the patient advocacy group, commissioned a report where they were looking at the experiences of LGBT plus patients in Derbyshire and what their experiences had been. And by and large, general practice came off pretty well. It said that participants were largely positive about their experience of general practice, but they did identify opportunities for improvement. And they did say that kind of one opportunity is that general practice could be more positive towards the LGBT plus community by displaying kind of information more prominently, and things such as sort of rainbow signs, rainbow flags. So I think that was the sort of main sort of specific point for general practice. And if I think about my own practice now and how we've tried to sort of put that into practical sort of ways. Really kind of what we've done is we try and make a very prominent sort of practice statement about our LGBT plus inclusivity, but we try to do that in a way that's sort of supportive. So as it says on here, you know, we strive to create a healthcare environment where patients feel comfortable and supported in sharing details about their sexuality and gender identity in their consultation. This helps us to provide you with the most relevant information to help you make the best possible informed decisions about your health and well-being. So we're very kind of keen to make it noticeable and obvious to patients that, you know, kind of when we're asking for this information, we're not doing it because we're prying, we're not doing it because we're nosy, it's because we recognize that by having that information about those patients, it means we can tailor appropriate healthcare to them and make sure that they're being guided in their sort of choices, and that we're not missing anything in terms of things that may well be relevant to looking after them. Similarly, when we have sort of health promotion boards, and I'm sure, you know, this is the case in all of your practices where you kind of have sort of rotating displays and things like that, that are sort of perhaps sort of change with the season. We try and have some health promotion boards that, you know, kind of look at LGBT plus health topics, but again, in quite an inclusive way. So sort of the one that's on the board here was really just a simple one about kind of thinking about all different types of families and showing that kind of we have a range of different family makeups within our practice. You know, there will be sort of children that have two mums, children that have two dads. And for me, kind of this does two things. First of all, kind of hopefully if you are an LGBT plus patient, you think, well, this is good, this practice can celebrate this. But more importantly, I think it begins to normalize that this is something for our non-LGBT plus patients as well. So in exactly the same way that, you know, we might have notes and sort of presentations that are particularly relevant to pregnant women, even though, you know, most of our patients will not be pregnant, we take exactly the same view with those promotion sort of materials for our LGBT plus patients as well. It helps to normalize that these are a, you know, kind of valued and you know, sort of component part of our patient mix. Similarly, from a consulting room point of view, that might be sort of the use of sort of visible pride logos in the consulting room. Certainly kind of by where my chaperone sort of sign is next to the examination couch, I have a pride flag that has our surgery in the middle of it. Equally, sort of a little rainbow sign around my door, little rainbow flag on the desk. Probably an overkill kind of from my perspective, but it just shows that these are kind of relatively sort of subtle things that are there for kind of the eyes to notice. I'm sure a lot of my patients for whom it's of no relevance whatsoever don't even kind of notice them, but it's just a sort of subtle way of kind of perhaps sort of demonstrating in the consulting environment that this is something that you're kind of prepared to kind of engage in a conversation about, and a safe space for patients to wish to have those discussions with whoever they're consulting with. Obviously, kind of increasingly as a practice, more and more of the information that we put out there is via sort of online channels, and I'm sure a lot of practices, not only through your practice website, but you might have sort of social media streams via Facebook, Twitter, other platforms. And again, sort of we've tried to kind of incorporate this work into our sort of social media and online surgery presence as well. So rather like sort of the supermarkets and other retailers, we've taken to changing our logo during sort of Pride season, and posting sort of topical things in relation to LGBT plus health as well. So I've got a few examples on here that we put sort of bits and pieces on about LGBT Pride Month, International Trans Day of Visibility, LGBT History Month. which again kind of helps to sort of normalise the fact that this is a component, sort of population amongst our other patients, but also kind of put things on that are of clinical relevance to patients. So back in May, when it was getting towards the final weeks of patients being able to have the monkeypox vaccine if they're in one of the eligible groups, again sort of putting that on our Facebook channel, normalizing that alongside other messages as well, what I've referred to as sort of challenging that heteronormativity. I won't go into a great deal about coding, but the Derbyshire practices have received, I think within the last 4 to 6 weeks or so, a questionnaire from one of the GPs in Derby, Paul Nathan, I believe, who's looking at the number of sort of patients from particularly the trans community, and that requires you searching your records for codes, and obviously kind of any search is only as good as the coding of the information that's been put in with it to start off with. And there have been sort of various changes around kind of coding, particularly about sort of what are the most acceptable codes to use around sort of gender dysphoria, around sort of trans status and gender identity, and rather than go through kind of the reams and reams of information that's available about that, particularly on the NHS England sort of website, the LGBT Foundation and NHS England have launched a really good practice guide to provide support for services to implement this sort of monitoring and data side of things. The document's called "If We're Not Counted, We Don't Count," and there's a link on the slide here. And that contains updated guidance, tips and case studies, and explains how best to sort of implement those sort of coding changes and check that kind of when you're doing your patient registrations and things like that, you're using the appropriate code. So it's certainly one that's well worth having a look at. If we move on to think about how we actually support members of staff that belong to the LGBT plus community. Last year in 2022, the British Medical Association and the Association of LGBTQ plus doctors and dentists, formerly called the Gay and Lesbian Association of Doctors and Dentists, and it still goes by GLAD as an acronym. They conducted some research looking at the experiences of discrimination that had been faced by LGBT plus doctors and medical students in the workplace. They'd done a similar survey in 2016, and they sort of recommissioned the survey last year just to see kind of whether there'd been any improvements in that intervening 6 years. It also surveyed the views of people that were outside the LGBT plus community, just to see if there was any difference between what the perceived environment was by people that weren't LGBT plus by comparison to the actual lived experiences of those that were LGBT plus. Now, it's worth noting that this survey included all medical specialities. It wasn't just focused on those working in primary care, and it was restricted to the experiences of doctors and medical students only, so it didn't include other members of practice staff. However, I think it provides a really useful barometer to highlight kind of what challenges these individuals were facing when employed within an NHS workplace. And I think it's fair to say that those findings would probably be replicated across other staffing groups in an NHS setting, and would probably be as relevant in primary care as in secondary care. So it provides food for thought for us as employers as well. So just to run through kind of some of the key findings on there, it said that many LGBT plus staff working in NHS settings didn't feel comfortable to be completely open with everyone in their workplace about their sexual orientation and or gender identity. And I always say to people, you know, you never stop coming out, you know, kind of there will always be patients who say to me, you know, what does your wife do when they see that I've got a wedding ring on? To which I will then explain, well, I don't have a wife, I have a husband. And sometimes, you know, kind of proud as I am of that, I will kind of slip into conversation where relevant. I will say my other half, just to kind of avoid kind of having to have a conversation with a patient who I think it's not, you know, kind of either relevant for, or I'm not entirely sure how that, you know, kind of information is going to be received. They said that there were notable differences in views on the extent to which, you know, homophobia and biphobia still existed within medicine. Of the lesbian and gay and bisexual members of staff, they thought that homophobia and biphobia were an issue in the wider profession, though the heterosexual people, when they were asked, do you think homophobia and biphobia is an issue, only a quarter of them said it was. So again, there was a big difference between the, you know, kind of lived experience and the, you know, sort of perceived experience by people it wasn't affecting. Only 1 in 20 of heterosexual respondents thought that this was an issue in their own workplace or place of study, compared with nearly 1/3 of the staff that belonged to the LGBTQ plus groups. As we sort of see in the media, again, kind of NHS sort of staff felt that transphobia in particular was more widely recognised as an ongoing issue within the medical setting. And I think certainly throughout these talks, and certainly looking at my own practice and commentaries, you know, within medical press and what have you, I think kind of the transphobia side of things is certainly a far greater issue now than it is for sort of the homophobia and biphobia. And I only hope that steps that have been made to improve things for the gay population can also continue to be the case for the transgender population. Again, kind of going on with some of these key findings, they said that the experience of homophobic, biphobic and transphobic behaviour was not uncommon. Over 40% of the lesbian, gay and bisexual staff had directly experienced homophobia or biphobia, and nearly half of trans members of staff said that they'd experienced transphobia themselves at least once in the past 2 years. And those experiences ranged from derogatory language, social exclusion, and having their professional competence doubted, to overt hostility, threats and violence alongside this behaviour. And that was behaviour that was coming to them from both other members of staff and, you know, kind of from patients as well. And there was concerns that some NHS staff were actually displaying these types of behaviours actually towards patients from the LGBT plus community as well, which is obviously distressing to hear. I think the other difficulty was that alongside more explicit experiences, as listed above, there were sort of low level, what we might call microaggressions, with sort of jokes and banter sort of in the workplace. And that, you know, can be, you know, kind of, again, you know, kind of incredibly sort of distressing for staff, particularly if it's on a repeated basis and sort of isn't called out and challenged. And, you know, thinking about sort of that ability to kind of challenge, it said that most incidents go unreported. Over 3/4 of the staff said that they had not reported their experiences to anyone, and that was for both lack of awareness about how to report their experiences and concerns about the potential negative impacts of reporting. Would it affect career progression, how they're viewed in the workplace, that type of thing. Equally, sort of people who witnessed homophobic, biphobic or transphobic behaviour directed towards others said that they were also unlikely to report it. Included, and reasons for that included lack of confidence that incidents would be addressed, and uncertainty about whether incidents were serious enough to report or not. And as I'd noted earlier, you know, people that weren't in those communities tended to perceive that their workplace was more inclusive and supportive than those from the relevant LGBTQ plus communities actually sort of felt and experienced. So I think kind of really when sort of thinking about kind of these sorts of effects on the workplaces, and particularly sort of thinking about primary care, if LGBTQ plus members of staff are less likely to feel that their places of work or study are safe places, that means that we need to do a lot more as employers. It was felt that more needed to be done to improve the visibility of measures to actually actively support inclusion. And whilst the majority of LGBT plus staff felt that the majority of people around them were generally supportive, there were still these ongoing negative experiences, but many of those staff felt that things were changing for the better, and that it meant that people were able to become more open about their identity at work, but that was probably as much due to kind of wider societal change in terms of, you know, kind of increased visibility, more awareness and education, rather than anything that was actually being specifically done from an NHS perspective. So kind of having thought about that, you know, I'm a partner myself, I'm an employer. I kind of thought to myself, well, okay, kind of how would that translate to any LGBT plus members of staff that we employed at our surgery? And in thinking about that, I've sort of tried to think of a few kind of key areas that might come into play with regards to employment of staff in a primary care setting, and how that might be you know, sort of affecting them from an employment perspective. So I think the first sort of challenge to ourselves is to kind of think, actually, as a practice, do we think that we work in a supportive environment where coffee room banter, what we refer to as those microaggressions on the previous slide, can be challenged, called out and dealt with appropriately? And I think under these circumstances, it's really important to think about the power relationships within your practice. You know, for instance, would, you know, kind of a 19-year-old gay male receptionist feel confident to call out, you know, homophobic banter that might be overheard between two much older heterosexual male GP partners in the corridor? I hope that he would, but, you know, I've certainly worked in practices whereby you can find that there's, you know, a distinct power relationship kind of between different members of staff. And it's one of the reasons why I've always been a firm believer that all members of staff in general practice, regardless of your role, should be on first name terms with each other. That might not be necessarily something you do in front of patients, but I think kind of when you're in an environment whereby, you know, sort of you refer to the GPs as Dr. Surname, but, you know, sort of the receptionists are by Christian name, first name rather. I kind of find that if you're all on the same name terms, it's another step at removing those hierarchical boundaries between the staffing groups, which act as that barrier to challenge behaviour. And in doing so, it kind of helps to promote that inclusion and integration of all staff within your practice. That's a personal view, but that's the reason why I've always held that view. Another kind of thing might be something as simple as a sort of a uniform policy. You know, does your practice have a uniform policy that's as flexible and adaptable to help employees express their sexual orientation or gender identity in a way that feels right for them, alongside being appropriate for, you know, sort of your organization's outward display of, you know, a smart member of staff to your patient group? Because at the end of the day, you probably already make allowances on other equality, diversity and inclusion grounds, for example, incorporating perhaps religious attire within your sort of uniform policy. So, you know, for example, would a female employee be welcome to wear a shirt and tie like a male counterpart in reception rather than a blouse? Would you make any judgments on, you know, sort of hairstyle or colouring for a patient facing staff member? Again, just sort of thoughts to have a think about. We've spoken in previous talks about LGBT plus people when they wish to start a family. Again, are things like your adoption leave arrangements for your staff fit for purpose when compared to your maternity leave arrangements within your practice's employment terms and conditions and partnership agreements? And I think certainly, kind of as a partner myself, whilst, kind of we as a couple haven't gone down the adoption route, I know that our partnership agreement, which tends just to be kind of passed down from one generation of partners to the next without, kind of regular review, because, you have to pay for the lawyers to come in, and that's always kind of costly. I know for a fact that, sort of there was hardly anything on adoption leave before I came in. And I made sure that, sort of were we to adopt a child, I would be afforded exactly the same sort of rights to leave as a heterosexual female member of staff would be with their maternity leaves. Equally, how would requests for planned work absence to undertake fertility treatment be viewed by your practice? If you look on the Equality and Human Rights Commission's section, the links below on managing staff absence due to fertility treatment, it does say that there are no kind of legal protections in law currently to be able to go for fertility treatment, but it does state that as employers you look upon this favourably and it not be included within sort of any disciplinary action around leave from work. One of the Conservative MPs last year was actually trying to get a bill put through Parliament to basically say that any kind of leave for fertility treatment would not be viewed as sickness absence. So that didn't manage to get onto the statute books before they ran out of parliamentary time. But whether it might be something that's introduced in the future or not, I don't know. But again, perhaps something to kind of think about. So here's me on my wedding day, and I only put that in to kind of have a think about how perhaps as a practice, in common conversation, you might refer to the significant others of your LGBT plus members of staff. So often kind of in the course of a conversation, you'll talk to your members of staff about, kind of, oh, how's your husband doing? How's your wife doing? Kind of that kind of thing. And actually, I think for LGBT plus members of staff, it's really important you've actually asked and you know how to refer to their significant others and find out how they want to be addressed. So, for example, for me, it's an absolute bugbear of mine when people refer to my husband as my partner. Now, I know that some people will do that because they're not sure about my marital status. And I know that some people will do that because they kind of think, well, partner's a relatively neutral term, and therefore I'm not going to offend by using it. But I always say, well, for a start off, I'm a GP partner. So my partners, to my mind, are the people I spend my day with, whereas my husband is somebody who I spend my night with. But secondly, as somebody that's fought for marriage equality for many years, to actually be told, actually for people to continually use the term partner, even when I've asked them to correct that to husband, it actually almost devalues kind of my marriage, and that kind of my sort of status as a husband is not held in the same respect as a man that's in a heterosexual marriage. And it's little things like that whereby, unless you've kind of asked the question and had the insight to even think kind of that might be something that causes a degree of distress or upset for people, you wouldn't necessarily kind of know about, which is why I've kind of raised it just as a little example today. And finally, at the other end of life, nominating a death in service beneficiary. Or every new member of staff that's coming into your surgery will either be in the NHS pension scheme already or will be joining the NHS pension scheme and will have the option to nominate a death in service beneficiary. I very much doubt in any kind of induction of staff, for new staff that are coming into the NHS, that you make a point of sort of saying to them, this is something that you can do. But I highlight it only because obviously kind of there are a number of LGBT plus staff alongside heterosexual staff that might not be in a legally recognised marriage or civil partnership with their significant other. And as such, if they were to pass away, their significant other obviously wouldn't be entitled to their pension unless they've been nominated as a death in service beneficiary. The corollary of that as well is that we've spoken in other sessions about the fact that LGBT plus members of the community might be more likely to be on poor terms with their family, based on kind of if there's been any breakdown of the family relationships. And again, if they haven't nominated their other half, and it automatically then goes to their next of kin, and that's next of kin is a family member that they've got a broken relationship with, that's probably not an ideal set of circumstances either. So just from an induction point of view, I'd almost say for all staff this is important, but particularly I think there's a few kind of extra nuances here around LGBT plus staff members that are worth thinking about. So just to kind of have a think about the different accreditation schemes and further sort of learning opportunities that are available for practices in this area, the LGBT Foundation has a scheme called Pride in Practice. And this is a scheme that that practices can sign up for to show their support for their LGBT plus patients. It tends to be have a particularly high uptake in sort of metropolitan areas where there's a bigger proportion of LGBT plus patients. So certainly lots of practices in sort of Manchester, Brighton, Birmingham, London, that kind of area have done this. And I believe there is a small cost to taking part in this to get the accreditation that just sort of covers the cost of the sort of support and materials that you are given. But again, it's one that different practices, kind of may wish to kind of look into. And as a program, it works with not only GP practices, but other health settings in primary care, like dental surgeries, pharmacies, and optometrists, to give them support in this area. So that's certainly one that you can look at that has a national footing. The Derbyshire LGBT plus Association, what used to be at one point in time referred to as Derbyshire Friend, I think they changed their name sort of within the last few years or so. They're now doing their own accreditation scheme that's for different organisations and businesses across Derbyshire, not purely restricted to kind of health-based organisations. They've done it with sort of businesses and sort of other social sort of groups, but they're doing a scheme themselves whereby they will put together this sort of what's called a rainbow accreditation scheme that takes the experience of Derbyshire sort of residents and has a more sort of localised approach to it. And again, their link is below. We have had some initial conversations as an LMC with the Derbyshire LGBT plus group, and there's the possibility that we might work with them to try and sort of design a kind of bespoke offer for general practice that uses some of their intellect, but kind of gives a support package that's specifically kind of designed and bespoke to general practice, rather than the generic offer that they're using across the organisations they've worked with before. So that's a sort of watch this space type sort of alert, really, kind of at present. Certainly other organisations that have worked through this in Derbyshire already include the councils, the Derbyshire Constabulary, EMAS, the Citizens Advice Bureau, and Ashgate Hospice, amongst others. So it is something that is being used by some of our partner organisations that would come into contact with in general practice. Similarly, just from the point of view of some links that might be useful, NHS employers have gathered together a number of resources regarding support that's available for LGBT plus members of staff within the NHS at the link attached. And I'm sure you're already aware of the various wellbeing support offers that Joined Up Care Derbyshire have put together. Similarly, Stonewall, they've got some useful resources for support for employers regarding making your workplace more inclusive as well. So I think kind of in summary, it's really just to say that LGBT plus patients benefit from accessing healthcare where there are visible signs that efforts are being made to promote diversity and inclusion, and that in the practice setting might include things in your waiting room, your signage, online resources or social media. We've spoken about that whilst things seem to have improved for LGBT plus NHS staff over the years, they're still reporting incidents of homophobia, biphobia and transphobia, and that might include in the primary care setting as well. I think as NHS employers, we should look at specific policies and explore the concerns of our own staff members to improve their working experience, but also help and attract and retain a skilled workforce from that community. And as I've noted, there's further training and accreditation schemes available for practices who wish to explore this work further in more detail. And as I say, that might include something coming from the LMC in the coming months that's working with Derbyshire LGBT plus to put something together specifically for general practice. But hopefully that's been sort of a helpful talk this afternoon. And as I say, kind of it concludes the 3 talks that have been done over the course of the summer. If there's any questions, I'm more than happy to take them now. Equally, my email address is on there should any further questions or comments come in the future. I'm always more than happy to answer any queries you might have.